Hi, my name is Lucy del Gaudio. I'm a U.S. Army veteran and veteran advocate. It's time to start talking about the changing transportation needs for veterans. A June 2020 report released by the Census Bureau showed that while the overall number of veterans is declining nationwide, there are changes happening in our demographic makeup in our communities that change the way we look at transportation needs and transportation insecurity. Compared to the previous cohorts of veterans, the incoming generation of veterans is more diverse in gender orientation, sexual orientation, racial identity, and is more likely to have disabilities related to their service. I repeat, it's time to start talking about the changing transportation needs of the veteran community. To further understand the needs of the community, we look at studies done at Rutgers University that found that working age veterans with disabilities face a multitude of issues when they seek to rejoin civilian life. They must secure housing and employment while coping with healthcare concerns that usually carry one or more disabilities. This is made increasingly difficult when you are most likely to be a single parent, when you are facing systemic injustices every day, when you're solely focused on providing the bare minimum for yourself and your family. Access to transportation, particularly public transportation and paratransit options, is truly a linchpin that impacts veterans' ability to meet the diverse needs successfully, and too often issues are not adequately considered in the standard veteran integration plan. More than 21 million veterans live in the United States. Of those, 2.2 million are women veterans, 5.5 are veterans of color, and 25% of them describe themselves as living with a disability. New evidence suggests that these figures may undercount, particularly among veterans of recent military conflicts, like those in Iraq and Afghanistan. As of 2014, approximately 3 million veterans who lived in rural areas or in tribal lands across the country will enroll in the VA healthcare system. In order to access VA services, these veterans have to travel long distances, many for many hours, from their rural homes to the nearest VA hospital or clinic or facility that has the services or equipment needed to assist them. Longer distances to healthcare facilities in rural areas also mean veterans may not have immediate access to type of healthcare providers and including specialists. While there are services that are dedicated for veterans to focus on transportation, to provide transportation for the veterans at no cost, and to employment trainings and other educational programs through organizations like the Disabled American Veterans or the Veteran Transportation and Community Living Initiative, the reality is that most communities don't have these types of programs available. VA mobility managers exist to coordinate transportation services for the different populations and have been used to meet the health and transit needs of the veterans. But again, access to these providers are limited. Transit and veterans need to be designed with intention. Looking at the greatest disparities veterans experience while trying to access transportation, with special attention paid to who is experiencing these barriers. Infrastructures must be expanded in both urban, under-resourced communities, as well as rural and tribal communities who experience the unique set of disparities. Funding must be available at not just the national level, but at the state, regional, and local level. Every state looks completely different when it comes to the landscape, transit utilization, transit accessibility, and veteran community. Together, we can create a transportation system designed to meet the unique needs of those who served our country. Thank you.
Thank you so much for sharing, Lucy, and for spotlighting this really critical issue. Uh, so you particularly brought up the concerns of veterans in rural and tribal areas, and uh, how long they have to travel just to access healthcare. and the lack of transportation options for them.
Yeah, it's a disparity because we have so many veterans. Again, we have 3 million veterans that are identified in rural and tribal communities that live in these communities that don't have accessibility to transit. It takes them hours upon hours to get just to their appointment and then hours to get back home. We've had instances where veterans have traveled 3 hours just for a half an hour appointment. And again, it shouldn't happen. We have to do better by getting more transportation hubs to veterans in these communities.
And I guess my follow-up question was, does this lack of transportation also become an added cost? Meaning, are they paying more out of pocket to be able to, let's say, get some kind of Uber service or something to go to their medical appointment instead of the public transportation they could have had?
Absolutely. We've had instances where you have to take either a Lyft or an Uber to get to where the transportation hub is, and then they have to pay that out of pocket. As we know, there's no type of reimbursement service that does that, but private institutions like Lyft have been able to provide veterans with free resources, and they have worked with organizations like the Minority Veterans of America that they have provided free Lyft services for veterans who need to get to their appointments.
Okay, thanks a lot, Lucy.
Thank you very
Lauren?
much.
Yeah, Lauren, do you